Hello everyone. In continuation to our series of videos wherein I am trying to touch upon various points of clinical relevance regarding what all should you know about removal of the Foley Urethral Catheter in adult male. This is the third video where I am talking about considerations after you have removed the Foley catheter, and this is for about 1 to 3 hours after the catheter removal. Once you have removed the catheter from a patient, you must ensure that there is restoration of efficient bladder emptying in that patient. And how should you do that? First is a clinical way wherein you ask the patient to maintain a frequency volume chart, and the patient may be voiding a normal amount of urine at normal interval. This means he may be voiding about 200 cc, 300 cc after 3-4 hours, and he tells you that I am able to pass urine completely. I do not have feeling of incomplete voiding after the act of urination. This is normal, and it is your responsibility to find out from the patient that actually this is happening or not happening, and not once, at least twice, and only then you send the patient home. But in case if patient says or the caregiver comes and tells you that this person is passing urine rather too often, and then the amount of urine this man is passing is very little, and now you should get alert, because this patient may be that he is not emptying his urinary bladder fully, and this is a real problem. If the patient is not emptying the bladder fully, he will surely develop urinary tract infection in a matter of day or two. Alternatively, the second situation may be because of longer indwelling catheter, the balloon creates some kind of edema on the trigone and bladder wall, and that's why patient passes urine rather too often. In this case, patient will be emptying the bladder completely. So what should you do? If the patient says, I am passing urine too often and in a small volume, you must do these 3 U tests to ensure the complete emptying of urinary bladder. One is uroflowmetry, second is ultrasonography of the urinary bladder, and third is a urine culture sensitivity test, because patient can develop symptomatic urinary infection. If you find bladder is completely empty, you can sleep in peace. But if bladder is not completely empty, you have the patient for longer duration under your supervision, and it is better to inform the treating doctor about this kind of a problem. Now then, there are certain common problems which you will see after catheter removal in most patients, and then you should know what to tell the patient. First thing is, many patients complain of burning sensation while passing urine. This is normal, and tell the patient that with every next episode of urination, the burning sensation will become lesser and lesser. This is because of mild inflammatory reaction in the urethra. The second thing patients often complain is that the urinary stream splays. Rather than coming in a spiraling fashion, it comes like a fountain. Because of the catheter inside the meatus, it becomes a rounded hole, not like a vertical slit. And when urine comes out of a rounded hole, it will be a fountain-like stream. This is normal. As the meatus takes its shape from round to slit, the stream will become spiraling back again. The third thing is, patients sometimes notice increased frequency of urination after catheter removal. This is again because of mild catheter-induced inflammatory reaction in the bladder. Fourth thing is to have some kind of blood in the urine. And if it is mild blood in the urine, tell the patient to drink more water. Very often it clears on its own. So what I would suggest, that you tell the patient about all these 4 problems after removing the catheter, and tell him to watch about it, or the caregiver to make a notice of all these things. If these things are improving on their own, it is fine. But if they are progressing, if they're becoming more serious, then you should be informed. Then there are certain uncommon problems after catheter removal, where if they happen, please inform the treating doctor as soon as you can. First is not being able to void completely. Patient develops failed voiding, develops urinary retention again, and then you will be required to place the catheter again. Second situation is patient starts throwing fever with chills. Now this is really serious, and have the patient in hospital, because now you will know parenteral antibiotics to manage this infection and possibly catheter back in again. The third thing is the amount of blood passed by the patient is more. The entire urine that he passed is bloody, and often there are blood clots. If that is the case, do not let this patient go home. Instead, inform the treating doctor as soon as you can. And rarely, in some patients who have undergone a reconstructive surgery on the urethra, or sometimes who have had a catheter for very long duration and urethra has developed some kind of inflammation or a stricture or an abscess, then as the catheter is removed and patient starts voiding, there occurs extravasation from urethra and a swelling develops on the undersurface of the penis. And this is not very common, but if a patient comes and tells you that I am having this problem, please notify it to the treating doctor of the patient. So I hope now you are informed enough about the issues related to removal of the Foley catheter, and I talked to you about considerations before catheter removal. In first video, I talked about considerations during catheter removal in second video, and then considerations after removal of the catheter in third video. And I hope you have found this piece of information very, very clinically useful. So thank you very much for your patient listening and your time.